Diagnostic Radiology Basics. What is diagnostic radiology?
Diagnostic radiology is now a very broad field which encompasses the use of a number of different imaging modalities that are fairly commonly known, including CT scanning, MRI, ultrasound, radiology, meaning radiography and x-rays, and nuclear medicine.
What is radiation in the medical sense?
Radiation is energy that is emitted in waves and particles. We can harness that energy in order to allow us to image parts of the body, and that is the basis for radiology.
What is natural radiation?
Natural radiation is radiation that we find in our environment and that we're exposed to in our environment. Examples include cosmic rays that come from outer space, and they are typically in the form of particles that come through our atmosphere. Other kinds of natural radiation can come from various portions of the earth, including rocks and elements that are in the ground.
How does diagnostic radiology aid diagnosis and treatment of diseases?
Radiology helps in the diagnosis and treatment of diseases by providing us with a look inside of our bodies. It allows us to do this without having to cut into the bodies, which is a huge advantage that wasn't available some 2 to 3 generations ago.
What conditions or diseases can diagnostic radiology help diagnose?
Some of the conditions that radiology can help diagnose include infections or cancers.
What are some of the different types of diagnostic radiology?
Some of the various aspects of diagnostic radiology include plain x-rays, which many patients are familiar with from broken bones when they have to go to the emergency room and have an x-ray of their ankle or of their hand. There are other forms of radiology imaging, including CT scanning or CAT scanning, MRI imaging, or ultrasound, and nuclear medicine.
What does a diagnostic radiologist do?
Diagnostic radiologist's main role is that of interpreting the images that are created by the various imaging modalities. But the diagnostic radiologist's role is also making sure that the equipment that's used is used appropriately and safely.
What does it take to become a diagnostic radiologist?
Diagnostic radiologist requires completion of medical school, followed by a 4-year radiology residency program, and frequently followed by additional training in fellowship training.
How many types of radiologists are there?
There are many subspecialty areas in radiology that encompass the field of radiology. They are generally those of diagnostic radiology, interventional radiology, and nuclear medicine. The diagnostic radiology arena can be subdivided further into subspecialty areas of interest, which include neuroradiology, musculoskeletal radiology, ultrasound, mammography and women's imaging, as well as some additional areas that are even more subspecialized than that.
How has diagnostic radiology changed the medical field?
Diagnostic radiology has changed the medical field by providing the opportunity to look inside the body without having to cut into it, which is an incredible feat when for many, many years the only ability we had to look inside the body was by physical examination, by listening to the body, by looking at the body from the outside. So we have improved our perspective and detail with which we can evaluate the body.
How long has diagnostic radiology been around?
Diagnostic radiology began when X-rays were discovered And when it was discovered that you could actually differentiate various parts of the body, such as seeing the bones, so that you could now detect fractures by looking at the bones rather than simply looking at the surface of the body part.